Lisa Gralinski, who's an assistant professor of epidemiology at the University of North Carolina. Really great to have you back, Lisa. What have we been learning about the genesis of the coronavirus and how it spread?
Thanks for having me back. So we've really learned that this coronavirus can spread very easily amongst people. And so that's why we're seeing all of these recommendations for social distancing, for staying home if you don't need to go out. And so it remains to be seen how well we can control the spread in the United States, but hopefully by taking these measures, spread and the number of cases will be able to go down.
How would you measure the Trump administration's response? Do you think that the U.S. government is doing enough right now to sort of contain these little clusters of outbreaks that we're seeing, like the one in New Rochelle?
I would like us to see us do more. It's always difficult to judge how fast you need to respond to a developing situation. Dr. Fauci from NIH has great advice, so my hope would be that they listen to him, consult with the experts, and take what measures might be necessary. Quarantine and such measures are very difficult. They can have an economic burden, but if that lets us stop spread of the virus and prevent things from really taking off in the United States, in a widespread manner, the way we've seen more localized in, New Rochelle or Seattle, that would really be to the benefit of the whole country.
A lot of us are wondering, particularly here in the U.S., Lisa, how bad is it going to get?
So that's a really big unknown. What we hear a lot of people talking about right now is kind of flattening the curve of the epidemic so that we don't get too many cases too rapidly that can overwhelm the hospital system. We saw that happen in China. We saw that happen in Italy right now. So if we know the virus is here. But if we can slow down the spread and prevent too many people from getting severely sick at one time, then we have an opportunity to really treat them and hope that we have good outcomes. If too many people are infected at one time, the number of severe cases can really just be too much for a hospital system in any one location to handle. And that's when you see a mortality rate really go much higher than we would like.
What are we learning right now, Lisa, about treatment and also just prevention? I mean, how far off would something like a vaccine be for this?
So there are a lot of vaccines in development right now, but in terms of getting something into people, I think Moderna has probably the fastest track on that, but clinical trials will start taking place over the summer. At this point, we don't even have an animal model to be able to test vaccines in right now. We have a lot of things, again, in progress. Realistically, a vaccine into people to try and prevent spread of this disease and not just in a testing type of situation wouldn't be happening until 2021 at the earliest.
All right. Lisa Gralinski, really appreciate your expertise. Thanks for being with us.
Thank you.